Kathy Clay, Battalion Chief Fire Marshal for Jackson Hole Fire EMS.
Kim Staus, I'm the Community Relations Education Specialist for the Pocatello Fire Department, Bannock County Ambulance District here in Pocatello. I'm really excited to be here and talk to you about what we're doing with our assisted living facilities and how it kind of can tie into the 5 E's of CRR, particularly the enforcement aspect. What we were seeing with our assisted living facilities is we were responding to them. They accounted for approximately 10% of our total call load. And through our data analysis is how we found this out. And so as we dived into the data, what we were finding is of those 10% of total calls, nearly 50% of those calls were no transport or non-emergent calls. And so given the fact that we are limited in resources, just like every other department out there, we knew we needed to come up with a plan to correct this. And so what we did, our senior staff met and really had two options. One, we could work with the facilities and try to come up with a plan on how we could resolve this in a more proactive approach, coming up with some protocols that worked for everybody. Or the alternative would be we would start going to our commissioners to get approval to start charging a show-up fee. And so what we did, we decided to start with the proactive approach and see how that went. So we went and met with each of our assisted living facilities, the administrator and each of the nurses, kind of gave them a report card or a rundown of what was going on at their facility, how many times we were showing up, what the no transport rate was, and we compared them to the overall picture. And that really helped to tie in and get buy-in as to why we needed to fix this problem. And so what we did is we formed a committee of 26 members involved the Area Agency on Aging, the Ombudsman, the administrator from the facilities that chose to participate, their nurses, the state licensing official for the assisted living facilities, our medical director, our senior staff, and some of our medics. And we really worked together and came up with a plan that both worked for us and for them. And they brought forth problems or concerns that they had. We brought forth concerns that we had. And we really designed the protocols to address when is it appropriate to call 911 and when is it appropriate for them to handle the situation within their own facility. And so we got those plans in place and got everybody to sign off on them. We implemented them. And they've been working great. At the 1 year mark, it was reduced by over 50%. And so the no transport rate went down by 50%, and the total calls went from the highest, I think was 11.6 down to like 4.4%. So substantially a different reduction in working with those facilities to come up with a plan and enforcing it essentially to make sure that it did work. One thing we did do is we went out and trained all their staff so that they too knew what the protocols were. And, we met consecutively, last year we met with them, reviewed the data for the prior year, asked them how it was working. They said it was working great. And the plan was this year to do that as well. And then we all got hit with COVID. And so needless to say, that's been pushed on the back burner. But I do have to say that by having these protocols has really helped us during this time, because had we been in the same situation, we would be going to these assisted living facilities so much more than we need to, potentially exposing their residents to COVID or our medics to COVID. And so really it has worked. It also has really helped with that relationship on, that they feel comfortable coming to us and we feel comfortable going to them and saying, what will work for you to address COVID? And we've even gotten to the point now that if it's a non-critical patient, they actually will bring the patient to the door for us. So reducing us even needing to go within their facility.
Kim, yours is such a great story. I heard about your program before COVID, and I'm so glad you brought that into today's conversation, because I think that's a really great example of how we've evolved with COVID at our back door. Every fire EMS organization in the nation in February of this year knew that their number one risk to their community were falls. That's every single one of our response. And we've been kind of trying to put our arms around falls as well, which is why we were so interested in your program over there, just not too far away in Pocatello. But I love how you evolved and how you recognized that once COVID came along, what you had in place really helped you. Just
Yes.
like you say, by eliminating the risk, those folks were empowered then to be able to know when they needed you and when they didn't. And you did all that work before you even saw that risk coming. So it's such a great story about community risk reduction, because that's something that we need to do all the time. We've got to be thinking about what's our next risk that's coming at us. And by preparing with your number one risk, which is all of our number one risk with falls, you were ready to be able to better mitigate that risk factor of COVID in your organization. Really well done. I'm super stoked about your program.
Well, thank you. And, I think you're absolutely right when you say, even if it had been something like nobody saw COVID coming, I would bet if you asked anybody, they never thought they would live through be involved in a pandemic. But it is so true in making those connections and being able to adapt those to the situation at hand. And I think that lends itself in so many ways. If it hadn't been a pandemic, if it had been something else, we built those relationships through addressing another problem that we can also use to facilitate the current situation.
Yep, it's so true. And I think community risk reduction for me says so many things. It says partnerships, right? It says those stakeholders that have a piece of something that we can all work together. It's about relationships, it's about trust, and it's about really putting a whole bunch of minds together to be able to solve a problem that would be much more difficult for just one mind to be able to handle. We're talking about enforcement today, and I always find that word to be kind of a hard word, right? Enforcement sounds kind of mean and difficult, but it's what we, especially in the United States, rely on to keep safe with our foods, to keep safe in our homes. There's probably no better example of enforcement in its finest in our smoke alarms that we have in our homes. When new houses are built, people get smoke alarms. They don't really even know about it, right? They know that there's something up there. They really don't think much about it. We make sure through our codes that those smoke alarms are in the right places, that they're going to do the right things for that family, at 2 a.m. when the fire happens. And they count on that. They don't question it. They don't ask about why they have to pay more for a smoke alarm. In our country, we have codes that regulate how much snow can go on a roof, so roofs don't collapse at the middle of the night. Again, it's understood the consumer is okay with that, right? They're okay with the fact that we have these rules that are keeping them safe through a fire or a snow load. And we, in our work, get to go out in prevention bureaus and fire departments and to make sure that these rules are followed so that people have that safety. So it's a really consumer benefit that I think is even though enforcement sounds like a hard word, it really helps us all in the end, whether we're helping people keep from falling and calling our services when we really don't need to go at the end of the day, taxing the system so that the real 911 call may have to wait until you get done picking up somebody who could have been picked up locally. So these are all great programs with enforcement at its key component, but yet not nearly as hard as it sounds in the end.
I would absolutely agree. And I think sometimes people, like you just mentioned, they connotate enforcement as a negative thing. And I don't think it has to be that way. What we do often when we go out to homes and we're doing, a falls assessment or doing a home safety check. And I try to tell them, smoke alarms, think of them you don't think about anything when you pay your insurance every month to protect your cars or to protect, your health insurance or whatever. I said, think of smoke alarms as the same way. I mean, that's a pretty inexpensive piece of equipment to buy that has the potential to save yours and your entire family's life. And when you really put it in perspective for them, they're like, oh, I never would have thought of it like that. And it's a small investment. And I think in a lot of ways, a lot of things that we do, it's just like when you go out to schools and, they're mandated under the code to do fire drills every month. And they never question it. And in the long run, then you hear of all these success stories when kids are at their home and they hear that smoke alarm going off, and it just is instinctive in them to get up, to get their family outside and to get to safety. And those are the stories that reaffirm and what we really try to share with people that, these do make a difference. And our whole goal is to save people's lives, and minimize property damage. And I think, enforcement doesn't always have to have a negative connotation with it. I think it's just, as you mentioned, it's building that relationship with those people and explaining to them how it can benefit them.
Yep, it's so true. And I look forward to establishing more and more relationships. We've obviously worked really hard and long with our public health partners through this COVID crisis. I think it's really important for all of us to, again, stay mindful of what's the next risk that could be coming to our communities, and how can we start to build those, just like you did, build those partnerships ahead of that next risk, so we're better able to respond, more flexible, more pliable, and more ready to be able to respond appropriately to keeping everybody safe.
I agree. And I think that, it goes back to that whole premise of the CRR, doing your analysis of your area and understanding your area, understanding the potential that you have. And really, I speak volumes of the whole CRR program. I mean, as we all experience lack of resources and have to do the most with the least amount, knowing your community, knowing those partners that you can reach out to is invaluable. I mean, you can do so much because it's hard for one person to do it alone, but a lot of other partners have same or similar objectives, and just knowing who those partners are and reaching out to them, you can go so far and help solve so many problems.
It's important soil to keep cultivating, because my guess is we probably won't be getting big budgets anytime soon. So
No.
that's a really good point to mention, and one for everybody to start thinking about, developing and cultivating those relationship and partnerships as we get taxed with our resources, but still, want to and need to respond to our community's needs. What a great presentation, Kim. You guys have done a magnificent job over there in Pocatello. I'm so proud to be your neighbor.
Thank you.
Thanks for telling us about that program.